Hello, I did my presentation for my second honors PowerPoint on the Myasthenia Gravis. I chose this one because when we did the neurological topic, we only talked about this for like 3 slides, and it really interested me. And so yeah, I wanted to go more in depth and see what it was. Okay, so here we go. So the definition of the Myasthenia Gravis is like an autoimmune disorder. It disrupts the neuromuscular junction. And with this disease, it has like a relapsing remitting type of course to it. So what causes this disease? It's an autoimmune disease. This is when antibodies, instead of attacking bacteria, attack the acetylcholine receptors in the neuromuscular junction. So they do this by blocking or destroying these receptors, and so therefore smaller amounts of the signal are received. It can also, another type of myasthenia gravis is when antibodies start attacking a protein called triazoline kinase, and this helps to form the nerve muscle junctions. So this can happen at any age, but typically it is found in women between 20 and 40, and then men who are older than 60. So risk factors. There's not many, just the genetics. If your family has this gene, you are more prone to get this or more likely to get this. And then some environmental factors do play a role in this sometimes. Not very often though. Signs and symptoms. It's pretty easy. So there's muscle weakness. It can be either in a single group of cells, like in a specific area, or it can be in a generalized area. And it typically ranges from mild to severe. If the bulbar and respiratory muscles are very severe, with muscle weakness, you will need ventilation and enteral feeding. Typically, this disease starts in the eyes with ptosis, which is drooping of the eyes, and then diplopia, which is a double vision. There's also fatigue, and a person can have trouble swallowing, chewing, speaking, and trouble expressing themselves through facial expressions. Statistics. So there's not much on this. Typically, there is about 14 to 20 people in 100,000 groups of people. So that means that there is about 36 to 60,000 cases in the U.S. today. And with each person who has myasthenia gravis, they have a 10 to 20% chance of having a thymus tumor as well. Testing. So how do we test for this? We use repeated muscle stimulation to test reflexes and strength. Coordination and balance are also tested. There's also an ice pack test. This is when a doctor will put an ice pack on the patient's eyes and wait 2 minutes and then see if the patient's muscle has fixed itself or not. Doctors will also do some blood testing and an EMG, which is an electromyography, which is kind of like the repeated muscle stimulation. So it measures the electrical activity traveling from the brain to the muscle itself. Treatment. So unfortunately with this disease, there is no cure. However, treatment is highly effective, and a person can actually live a normal life with all the treatment that there is. So treatment. So there is a surgically removal of the thymus if that is part of the problem. And then there is also some tensilin injections. And this will prevent the acetylcholinesterase enzyme from attacking the receptors and stuff like that. And then this means, again, that the ACH will stay in the synaptic gap longer, and that will cause more stimulation, so less drooping of eyes and less muscle weakness because you are getting that stimulation of the ACH. Complications. So people who have this disease can become depressed, They will have like a reduced quality of life. Sometimes they can get feelings of hopelessness, and they don't really see like their perception of well-being being very high. And then especially if like there's in like an environment that's very hot, or they're very stressed, or they exercise a lot, their muscle weakness can become more intense. Myasthenic crisis is when the respiratory muscles are being affected by the lack of ACH receptors. So this is like when they can't breathe. And so a lot of people who get the myasthenia crisis end up in the hospital. And then those are my references. So I hope you liked it. And yeah, last presentation. Yay for finals. Merry Christmas.